Uterine artery embolization is a minimally invasive procedure used to treat fibroid tumors of the uterus, and it's performed under local anesthesia. It needs only a tiny incision, making it less invasive than other treatments such as myomectomy, which is surgical removal of uterine fibroid, or hysterectomy, which include removing the entire uterus. Uterine fibroid embolization can shrink the tumor inside the uterus, which is called fibroids, and require no hospital stay. The symptoms of fibroids that require uterine artery embolization: when the fibroid results in severe anemia from severe uterine bleeding from such hypervascular fibroids, or from the pressure manifestation from the enlarged uterus that result in multiple urination attacks and frequency, or suffering from long-standing constipation, or increase the belly of the abdomen, rarely cause pain, especially during sexual intercourse, which is called dyspareunia. This pain in pelvic region or pain in the back, mostly resulting from large size fibroid which compress nearby nerve roots. Regarding the technique for uterine artery embolization, it's a simple technique depending on a catheter which introduced through either femoral puncture in the upper aspect of the leg, or the radial puncture at the level of the wrist, then a guided fluoroscopy to catheterize the blood supply inside the uterus that supplies these fibroids, and a tiny particles are injected to dampen the flow of the blood to this fibroid, inducing its gradual shrinking and control the bleeding attacks or menorrhagia, severe attacks of bleeding that come to the patient during the menses, and the patient is retaining his normal life and returning his home mostly at the same day. One of the most important advantages of the uterine fibroid embolization as an alternative for surgical intervention, or alternative for the use of hormonal replacement therapy without any risk, including management of the bleeding attacks or the pressure manifestation or the deeply seated pelvic pain, without the need, or as we said before, for hormonal treatment or surgical intervention, and the patient will regain his life as soon as possible, with easy recovery and with no signs of surgical scar.